Gary, welcome to the show. Good to be with you.
Hi guys, how's it going, Pat? Hi,
Hey,
Chewie.
Gary.
Yeah, it's going good, man. How you doing? How you feeling about life at the moment?
Yeah, no, I had a good shift. We were only at about 110% capacity today in ED, and so that's awesome. We were busy, but not badly overwhelmed, and I felt like we were able to give good care to patients, and so that's a good shift. That's a really good shift.
You released a spectacular podcast this morning. Do you want to give us, 60 seconds on the podcast that was put out today to let people know about it so they can go check it out?
Yeah, we've actually got 5 or 6 now that
so.
You've helped me birth out into the world, and these are looking at things as varied as um, nurse staffing ratios, public sector strikes, what government is doing to cancel the census as we know it and recast it in a different image. So we're talking with professors, emerita, workers, whoever really wants to add something to this conversation and talk about specifics. And so, yeah, I think recently the one you're probably referring to is the talk I had with Odie Matson, and that was quite incredible. It was a chance to refute and rebuke this health minister called Simeon Brown, who insists on going on Twitter and Facebook and personally attacking doctors and nurses. Very petty, very very. I was going to say he lies a lot, but what's a nicer way of saying that? Very misleading tweets and sharing of numbers. So we just tear it apart in a line by line from the point of view of a public doctor and a public nurse telling you this is how it is. So hopefully people want to listen to that. It's on the front line. And I think really I would like Simeon Brown to listen to it. So what I would say is we need to have an open invite to that gentleman to come and talk to us at least 30 minutes, because I don't want sound bites. I don't want him doing the usual. I want him to have some accountability and talk with people who can hit back. Yeah.
And as you're seeing in the chat, lots of love about the podcast this morning and the podcast.
Hi, Josie. Thank you.
Gary's podcast is amazing.
I don't know if I'd go that far, but the cool thing is we get to talk about things at some length, and you get to hear the real story. Because if you're just going off of 4-second sound bites, you're going to be woefully misinformed on almost every issue that's essential and critical for the public to know about.
All right. Let us get into this conversation. Now, I don't know if you know them personally, but we're going to have hear from Dr. Phil Bagshaw and Dame Sue Bagshaw, who I believe either both are, or Dr. Phil is the founder of the Canterbury Charity Hospital. I don't know. Do you know them personally? You certainly have an opinion on them. Do you want to tell us?
I don't know them personally. I just have revered them for about the past 18 years since I've lived in here. Yeah, Phil Bagshaw is a general surgeon and, like you said, started a charity hospital because he described a gap between public and private that many more patients are falling into. You know, a lot of people get knocked off waiting lists now in the public sector and can't even get on them. And so he basically said, we have a lot of people dying of colon cancer. I'm going to start endoscopy, and it's going to be a charity hospital, so supported by donations and with services free to the public. And it's huge now. Like it's open every day of the week, and it's doing hernias and all kinds of general surgery, endoscopy, and a whole bunch of other stuff. And his wife is this amazing woman who I think is a pediatric specialist in adolescent medicine. So that too, like these people did not go into it for the money. They are in it to help the public. I have immense respect for them. These are the best people, the best doctors.
So let's get into this conversation, and it's so exciting to have you with us for this, Gary, because then me and Chewie can just shut up and you can spit the truth. So as everybody knows, Gary, I'm sure you know as well, what we typically do is we play a few clips and we have a bit of a chat about the clips and we go through what we've heard. And there is so much more to this interview than even we're going to show, including, Gary, you're mentioning what incredible people these are. Actively, Dr. Phil actively going, I would like to make my charity hospital obsolete. They don't want it anymore because they want the system to be working correctly. But they start with the conversation around New Zealand moving towards a US style health system. And Jack just asked them quite simply, what are your concerns?
Well, we're concerned that the Minister of Health wants to offer 10-year contracts to farm out non-urgent surgical care into the private sector. And we think that's a very retrograde step.
Why?
Well, there are a whole load of reasons, but it will mean there'll be less money for the public sector. It means that the doctors will gravitate into the private sector. There will be no teaching or training. For lots and lots of reasons, it will mean the public sector will go down as the private sector goes up.
One of the points they made in this conversation, Gary, and I mean, obviously it's obvious when you think about it, but I never thought about it. All of the training happens in the public sector. All of the training for new doctors, all of the students, and it happens in the public sector. So if you're weakening the public sector, you're also damaging the future of the New Zealand medical institution because nothing happens in the private sector. Your thoughts about what he had to say there?
He speaks the truth. So I want to point out to you that something he didn't mention, but an incredible condemnation of the way policy is being run. A public hospital trying to do the right thing for patients has an annual budget and struggles to try to put programs in place beyond that. The answer, if you want to hire more nurses or you need more resources, we don't have money and it's outside our funding window. We can't give you that money or give you that assurance. But this government, if you are a private hospital corporation, an Australian multinational like the one that owns White Cross, they are willing to give them a 10-year financial contract. They are willing to give blood-sucking private corporations a 10-year guarantee on public taxpayer funding, our money, and they will not even give the public system a 1-year guarantee that we will have enough staffing a year from now. Now, that can't be done. It's mind-boggling the amount of wool that has been pulled over people's eyes when they hear this stuff. They think, oh, a 10-year contract, that's no big deal. When you understand how incredibly favoring that is of the for-profit system, you just realize that this is just effed up. It's just beyond belief.
So what you're basically saying, if I understand you, is you guys sitting there in the hospital aren't quite clear on what your funding will be at the next budget. So you can't plan past beyond that, whereas these guys are given a green light for a decade to be able to do exactly what they want to do.
Absolutely. I'll give you a very concrete example. We keep being told in my town that we're going to have a hospital built and it's coming soon. 2032, it's supposed to go operational. But the money for that, for the final stage, like tranche 3 or whatever it's called, stage 3, where they actually build the wards, the patient towers, where the medical and surgical patients will stay overnight, like i.e. the hospital.
Yeah.
That has, the money for that has not been appropriated yet. It's not been guaranteed or set aside. So we are literally being told we're going to get a hospital, but the money isn't quite there yet. And these private hospitals, which are popping up all over the place, private ICUs, $100 million refurbishments and doubling and expansions. You read about it literally on an almost weekly basis. Yeah, there's one. Dunedin, Christchurch, Auckland, massive expansion in the private sector. And they are getting a 10-year contract. It is just turning decency on its head. It's
There's a story that we're not going to feature tonight, but it might be a time to speak to it if you want. It's an exclusive to One News about Nelson Hospital. Now, I'm kind of clear on what they're saying, because apparently there's a guarantee people will be seen within 2 years. And it appears what they're doing at Nelson Hospital, now I'm a moron, so I'm trying to get this right, is they're putting people on a list for appointments where there's no appointments to be had. And it says on the documentation not to notify the patient. So what it means is then they're in the system within the 2 year period, even though they don't have an appointment. So they don't tell the patients that there's an appointment, but they put them in the system for an appointment, which means then they're in the system. If it takes them another 3 or 4 years to get to them, they've had the first appointment within the first 2 years. Are you highlighting that, Chewie? Is that as it reads to you? That's how it read to me on the news tonight.
Yep.
So yeah, do not contact patients. So the patient has an appointment, they're in the system. Technically, they're in the system to be seen, but don't tell them they're in the system. And that means that we fulfill the criteria of 2 years by this government. It's just weird. I mean, I don't know I know you were working this evening, Gary, so you may not have heard about that, but if you've got any thoughts around that, would love to hear them.
No, but I mean, there's a long history of giving patients a ticket to nowhere, putting them on a list that dematerializes. I mean, just today, this thing, the Specialist magazine, I guess you'd call it, it's put out by the Public Doctors Union. It talks about how the private sector was given an enormous contract, crazy money, to go through patients and decide what their priority would be and who could get seen in public and private. And they ended up sending 68% of the people on that urology surgical list back to their GPs to start the process over. And the reason they used is, from the time these poor people got on the list to when they were reviewed, the criteria had changed. They had made everything harder. And so these people could be summarily dismissed, just knocked off the list and put back to a GP. That's a very effective, if evil, way of dealing with a waiting list. You change the criteria and you ensure they never get a fair hearing. They never get to see the urology specialist. They're just off of it. And it's just like what you're describing. It's giving people a ticket to nowhere, smoke and mirrors. We're pretending we're dealing to the problem, but we're not. There's nothing there. There's nothing of substance there.
Ironically, and that's exactly what they did with the Equal Pay Act. It's exactly what they did. They changed the criteria, then they cancelled all of those equal pay negotiations. Then you guys can start again now. It's exactly the same.
They raised the criteria to 70%, knowing that, I don't know, many of those groups were at 65, 68% female predominance, and they knew they wouldn't qualify. It's almost like they set the number on purpose to exclude the majority, which is frankly probably what they did.
Let's get to the next clip. So we still get these guys in who are amazing. Dr. Phil Bagshaw. Jack asked about how does what we have, how does the system now start to move towards a US system? What happens?
Well, it becomes more and more focused on a sort of neoliberal philosophy, where hospitals are there to make money, and we purchase health. That's the notion. It's a commodity. Health is not a commodity. Health is a common good. And unless we focus on fulfilling the common good, then what happens is we end up solely focused on the money. And that's what an American system does.
You say that this trend has been in place since the late 1980s. How so?
The trend started with Rogernomics. That was the first hit. And then the really big hit was 1990, when we had the mother of all budgets. Both of those really started to take all the resources out of health. And progressively since then, the public system has been getting less and less resources.
Clip number 2. Chewie, you've been quiet so far. Do you want to say anything? And then, of course, Gary.
I'm quiet because I've been seething. Yeah, look, yet another very smart, very motivated person pointing out that the fucking wheels came off thanks to Rogernomics and the mother of all budgets. And this government seems to be looking at those two particular areas as just a gold mine of great fucking ideas.
The gold standard.
Oh, look, brilliant. Never been a bad idea out of that time period. These 10-year contracts, the first thing that jumped out to my mind wasn't about patients or that sort of thing. What a great thing to put out in a prospectus to your board members, to your shareholders, that we've got a funnel for public money secured for the next 10 years. Please buy more shares.
Exactly.
First thing that sprung to mind.
Precisely.
And this government has so many links to private healthcare. It's stacking up their portfolios. You know, you got Shane Retty, like it's what, half shares in a couple of private clinics and that sort of thing. Like, it's so bald-faced, out in the open, fucking corruption that is really rustling my jimmies tonight. And it's healthcare. It's something that affects every single one of us. And if they can lock down 10-year contracts, like, you know, government terms, what, 3 years, 4 years?
Exactly.
Yeah, and they won't have any. They won't be able to do that without getting sued to oblivion for breaking the contract. Yeah, it's bullshit.
They're creating problems that won't be fixable for a generation.
Oh, yeah, that's heavy to hear, and you are exactly right. But I didn't want it verbalized quite like that because it's like a gut punch. Oh, yeah, generation of having our healthcare system like destroyed on purpose, just crashed into the ground. So people
But
can
always remember, it's going to help some people. Like, you may not like it, a pensioner may not like it, but my God, if you are in private radiology, private telehealth, private surgical centers, private hospitals, private health insurance, these are the best times in history, probably. The amount of money, when you can privatize public services, the amount of money is incredible. And it's worth remembering, the way you do that is to defund and destabilize first. So you get people antsy and desperate, so that when you come along and say privatization's the only answer, lots of them will say, well, yes, I do need care. I'll take it wherever I can get it, even if it hollows out and erodes the public sector. And the public sector will be much weaker when I need it in the future. So this is they're winning. Just no doubt about it. They're executing very effectively their program, and it's working. They are privatizing by the hundreds of millions. It's really incredible. Like, we're not like beginning down that path. We are already far down it. And I'm not at all convinced. I mean, I do these shows to try to raise awareness. I'm not at all convinced that with anything short of outright direct action by hundreds of thousands, that we're going to be able to salvage essential public services in New Zealand. We are becoming a two-tier country of haves and have-nots. Yeah, I mean, look, outsourcing doubled to $350 million. These are not small amounts. And while the people in our departments would like to know if they're going to be if there's going to be jobs for them, if there's going to be a new MRI machine in the future, if our hospital rebuilds are actually happening, or whether that's a bit of a smoke and mirrors thing. You know, meanwhile, again, privates are getting 10-year guarantees. So this is, it's almost set in stone, and it requires a repudiation so vast that we cast the people doing these policies back under the rocks where they belong. Like, these people have climbed out of the ooze in order to rob the common good for private profit, and they should just be sent packing. And that's my hope, is that more people see what's going on and get angry.
There's a part of the conversation there, Dame Sue Bagshaw talks about a quarter of New Zealand can't access GPs. Let's just get to that part of the conversation and then we'll continue with our little chats.
Well, when you live in a country where a quarter of the population can't access a GP, that's something to worry about. And when you live in a country where many, many general practices are now being run by commercial companies, that's something to worry about, because they're there to help their stakeholders. They're there to pay their share holders.
But again, it comes down to a question of efficiency, and I go back to those numbers.
When you have managers in charge who don't know about how to deliver health, all they care about is how much it costs, you're going to get inefficiencies.
Right, and so
it's guaranteed.
Are you suggesting that the health services and an increasing bureaucracy in public health services are to blame for that massive expansion spending and a reduction in services?
Absolutely. The private sector is run by doctors and nurses, and they say when they can do the operation and what operation they're going to do. Not in the public system.
So the private sector is more efficient?
Only because it does very small cases with least complications and least complexity, if you like.
And the public system is there to pick up the problems as they arise.
So a decade ago, 98% of patients waited less than 4 months.
That's the next clip we'll go into. But that, Gary, made me think about when you've talked to us about giving $50 million to the private sector. They pick out all the easier surgeries, they do those, and when those surgeries go wrong, they end up back in the public system anyway. Seemed to be what they were saying.
Absolutely. And so Health New Zealand data, New Zealand government audits have shown that the least cost-effective, most inefficient thing you can do is outsource your cases to the private sector. International literature has shown that you get worse outcomes, higher morbidity rates, higher complication rates, higher death rates when we're comparing apples to apples. But the thing to remember, that's in the private sector. The thing to remember, though, is we're almost never able to compare apples to apples, because these privates, they don't take my patients. They don't take the sick person with diabetes and high blood pressure who's had surgeries before and who's complex. They don't take acute cases and emergencies. They do the most profitable things. And so if you've got a quick flick, maybe a cataract to do, they're there for you. As soon as that patient goes bad, so they have a complication, they're out of there. They are shipped off to the public hospital. So the private hospital keeps all of the profits, and they outsource all of the damages and cost and trouble to the public sector, to the taxpayers. It's a rort.
That's the classic big business model, though. You privatize the profits and you socialize the losses. I mean, you think about anything like the American car companies that were going to go bankrupt, and they lost all that money through the global financial crisis. It was the government that bailed them out. They socialized their losses and get help from us, but they keep all the profits themselves. That's not just a practice within the health system, but within lots of business, unfortunately. Chewie, do you want to add anything to that before we go to our next clip?
Look, can we just make these two the head of the health sector? Just somehow just give them the keys to the castle and just let them have at it, because I have infinitely more trust in these two based off these clips alone than I have with anyone at Health New Zealand at the moment at the top. Like, if they want to try something radical, let's do that. Give them the budget and the ability to change.
The other thing they did, Chewie, and we're not showing all of it, but we do have an example here, is when Jack came out. We like Jack. We like him knowing his facts and figures and his numbers. And when he brought some numbers out, they actually laughed in his face, going, those numbers aren't right. And he's like, well, these are the numbers in the budget. And they went, yeah, but they're not right. And this is one of those examples. They talk about I've written down waiting list lie. So Jack uses information about the waiting list, sort of, bad labour, pre-national, back in the days 10 years ago. And they just kind of go, yeah, no, that's not true. So not only did they have interesting ideas, they also smashed a lot of what they said was incorrect numbers through this conversation as well.
98% of patients waited less than 4 months for elective surgery in
No,
the public
they
system.
did not.
The waiting list figures are an absolute nonsense.
Today it's 57% according
No, that's
to those
not
numbers.
true. Now they're counting them before they didn't.
Right. You dispute those figures?
Oh, yeah. At
Without
one
a
time,
doubt.
there was a very simple system in New Zealand. Your GP thought you needed to be seen in a hospital. Your specialist in the hospital thought you needed an operation. You got your name written on a list and have an operation. Now, you go to your GP will go to the computer, and the computer will say, no, we're not doing that right now.
So, Phil, for any...
So there's a little clip there. So laughing in the face of, and they did it in previous times in this conversation around budgets and how much is spent, etc. as well. But the waiting list lie, how it wasn't amazing 10 years ago because these are all new numbers. Any thoughts, Gary? Any light to add to that shade?
Yeah, I mean, like any numeric target, it can be gamed. We're gaming these numbers every day. I mean, we see how that works, but just a simple thing with the waiting list of changing the criteria will knock off thousands. Saying that a person has been on a waiting list too long and knocking them off for that reason. So what they'll say is, oh, you've been on this list, or you thousands of patients have been on this list for so long that maybe your condition got better. Maybe you don't even need it anymore.
Is that how it works?
So we're going to put you back to your GP to force you to go through the system again to see if you still need to be on it because it's taken us this long to get to you. So there's a million ways to skin this cat and to fake the waiting list numbers and almost anything else. There's lots of ways. Yeah, I could go into them for you, but that's a separate conversation.
Maybe what we'll do, Chewie, is just roll straight into the second one, because I know this will your little socialist heart will love this conversation, because like any good interviewer in this day and age of neoliberalism and profits, Jack wants to know, but where's the money coming from? And they just give a straight up answer.
So
Incredible.
if it requires a huge financial input, and I've described the financial input of just over the last few years that perhaps hasn't been met by an increase in services, where does the money come from?
It has to come from the people. But, 1% of the New Zealand public own the country. I mean, the billions of dollars. It's really interesting. Money is one of the few things in the world which defies the laws of gravity.
This is great.
It floats up. Under the neoliberal system, all the money that you're talking about has been floating up to the top. And the bottom 25% haven't really got enough money to live on.
So you're talking about more borrowing, or are you talking about higher taxation, or are you talking about a combination?
Higher taxation and, I would like to see a big wealth tax, personally. The problem with wealth tax is the very wealthy hide all their resources.
Do you think there is an appetite in the New Zealand public for what would be quite a radical shift when it comes to tax and redistribution in order to fulfil what you see as a better healthcare system?
I think if they felt their taxes went into health and nowhere else, I think there will be more. There was a survey done not that long ago saying, would you be prepared to pay more taxes in order to have better health system and education system? The vast majority said yes, so long as they know where it's going. At the moment, we pay our taxes, we have no idea where it goes.
There you go, Chewie. You said, can these guys run the health system? Maybe they should run the whole country. I don't know, I just thought, Chewie. You want to have a go at it, sir?
Oh, yes. Don't look. Everybody knows what the answer is, and it is tax the wealthy. And we can look at the evidence, and the evidence is we used to, and things were better then. We had wonderful top of the line hospitals. We built them from one end of the country to the other, all at once. Like, how did that happen? Now we're going, well, Otago, you could have a hospital, and Nelson could have a hospital, but not at the same time. Here's a knife in the arena, fight for it. Like, this is the thing. All they've got is the wealthy turning around going, well, if you try and tax me, I'll hide it and run away. So we lose nothing. They're getting away with it now. And we're just quibbling and everybody's going, oh, well, we don't have any money. There is. We have the tools to do it. The tax system needs to change. And the health system needs to change because it has a huge influx of money. They're exactly right. No one's going to argue about money going into the health system and money going into the education system. Nearly every citizen of this country interacts with those two systems. We can't see them being starved of funding, starved of resources, starved of productivity, moving forward and all of that sort of stuff. We can all see it. It's just that our current government is going, well, we just don't have any ideas. We haven't tried anything and we're not going to, but we don't have any ideas. I guess we'll just have to keep cutting things.
Gary, that's the end of our clips. Love for you to sort of wrap up what we've been seeing and hearing from these two amazing New Zealanders.
Yeah, how do I summarize or give proper credit to a guy that says health is not a commodity, it's a common good? There's nothing I believe more about health than that. Health is not a commodity, it's a common good. And when these people, these businessmen, so-called businessmen like Christopher Luxon, say that it needs to be run like a business, you've got to push back. And none of the mainstream media does, because they're being run like businesses, right? Their public quality of public media is that it's basically being attacked and destroyed, no different than hospitals. And so we don't have anyone really pushing for the common good, at least not in a concerted way. And so when you hear common sense from these two senior doctors who spent a lifetime helping people, it really hits home. It is a common good. It's something that we did do before. So in my neck of the woods, we had 12 beds per 1,000. We now have something like 2.6. This is like 40 years ago. We were doing better building hospitals and supplying hospitals to our public. Think of my hospital. Parts of it now are 60 to 70 years old and really falling down. That was built for a population that was less than half what it is today.
Yeah.
They did a good job of building things back then and building them to scale in a way that we just cannot, because it's always about austerity. But remember, it's always austerity for the poor and the average and the working class and pensioners and students. It's never austerity for the corporations, right? It's a 10-year gold-plated contract for an Australian multinational that owns our urgent cares, right? They don't have austerity. There's no money to hire nurses, right? We know that 10,000 nurses in a year got their Australian registration, right? It's catastrophic. So they can brag about having increased numbers of nurses hired. But if you are hemorrhaging them, it's like putting a Band-Aid on when your carotid artery is severed. We are losing them at this insane record rate. I think that was a 53% increase from the year before, over 10,000 New Zealand nurses getting registered in Australia. That's an expensive process to do that and time consuming. And you don't do that lightly. You do that when you're ready to bail or you have bailed. And I mean, that's what we're seeing. We're seeing just widespread degradation, but only for some. Remember, this is a time of great profits for the private sector. And if ever there was a time for you to invest in private healthcare, it is now. Because if these, I'm not even joking, this is the time for Shane Retty to buy even more shares in Kensington Private Hospital and Surgical Center, because it's going to go like gangbusters. They have guaranteed hundreds of millions of our taxpayer dollars now being guaranteed over 10-year time periods, and with gleeful abandon from Simeon Brown, saying he wants to see all elective surgeries privatized. These people are telling you what they are doing to you, and yet we somehow think it's okay. And I do want to say the two most common things people will say, but isn't it good that I can get my hip done in private? And indeed, sir or madam, it is good that you can get your hip done faster. But what you have to realize is that 70% of the doctors in private came from public. They were enticed out. And these millions will only cause a hollowing out and, again, a hemorrhage of anesthetists. That's the largest number of a kind of doctors that we are losing from public and into private are the anesthetists, because they have a marketable skill they can take into private that will be highly reimbursed. And it leaves our public system screwed. I don't think you understand, you guys understand, but I don't think the average public person understands that, yes, you're going to get your first cataract. So they'll do your left eye in private. But when you return to the public system because you have an emergency in your right eye, you are going to be stuffed. The surgeons and anesthetists will be gone, and they don't come back from private, right? They're getting paid well to cherry pick cases and do the least sick, least complex, and most profitable ones out in private. I mean, this is catastrophic on every level, and it goes deeper and deeper and deeper. I could sit here for hours and talk about it, but I want people to understand that when you applaud the hollowing out of the public sector, the shifting of, in just one case, $350 million that could have gone to build your new surgical theaters at your hospital, that money has gone to private. And what will happen is you'll end up with now I came from the US 20 years ago, 18 years ago. So I can tell you what happens. Private gains a monopoly. When they become the only game in town and your public hospital is the place of last resort that no one wants to go to because it's just crap and it's dysfunctional and nothing works there, then you've created the right circumstances for privatization. Public suffering drives privatization. It drives private profits. And what you're going to see is a monopoly, just like our monopolies in our energy companies, just like our monopolies in our supermarkets, just like our monopolies in our offshore banks that, again, we're hemorrhaging money abroad. We won't see that money again. In fact, in most cases, we don't even collect proper taxes on it. It escapes. And that's what we're now seeing in healthcare. This is a time for the robber barons to be moving into New Zealand. It's a small market, but it's a profitable one. And whenever you see the words private equity or venture capital attached to your healthcare as a citizen of New Zealand, you know what will happen to you. You will be predated upon. The vultures are out, and you are not a patient who deserves care. You are their next meal.
Well, Gary, it's always so cheery to talk to you with the lovely, nice words we get out there, he says, with his tongue held firmly in his cheek. No, in all seriousness, thank you for being a part of this tonight. Thank you for coming on board and explaining, clearly and accurately what we need to do and what we need to be aware of, because, if we want to do anything about it, there's an obvious thing that needs to happen in about 14 months from now. This is a systemic problem, obviously. The health system hasn't been broken in the last 20 months, but I think most people would say that jet fuel has been poured on it in this last 20 months. Exactly. So we need to see a result in about 15, 16 months from now that might give us a chance to save what we can save. You say it's going to be a generational issue, but maybe if we have a change in leadership, there can be some kind of pullbacks. I'm not sure.
That's the bare minimum. But waiting 14 months or whatever it is for an election is not enough. People need to understand what's going on. So that's where shows like yours become so important. And they need to understand that they can take action. These people are dependent, these politicians that are doing this, who will never end up waiting 7 hours in my emergency department to be seen by a doctor, right? Mm-hmm. They have private health insurance. They have private hospitals that are just getting bigger and bigger and bigger and having their own ICUs now. These people are not like us, and they do not like us. And so people have to get out now and start protesting. And if you've got a pot, take it to your local MP and start banging. They must be named and shamed. And this is why I'm doing the frontline thing with nurses. Every single bullshit, lying quote that these guys put out on Twitter and Facebook, Simeon, Lester Levy, Retty before him, you know, the whole coalition of jackals. Every time these people speak, it needs to be thrown back in their face. We need to be united. We need to ensure that we're part of a union, because without collective bargaining, you are defenseless. You have nothing. And the nurses need to get with the doctors, need to get with the patients, need to get with the beneficiaries and the pensioners to say enough's enough. It will not be tolerated, and it stops today. And casting them out in 14 months is not enough. They can do so much more damage in 14 months to enshrine their changes, collapse the system. I mean, this is arson. You don't look at someone that's about ready to burn down your home, to burn down your public library, to burn down your hospital. You don't look at them and say, we're going to give you another 14 months to set the fires. You stop them.
Gary, thanks for joining us tonight. As you've just noted as well, people can find you on the front line. At the moment, episodes are going out Mondays and Fridays. We'll see how and if that continues on what kind of scheduling, but that's what's happening at the moment. Always a pleasure to have you. Thank you for making some time this evening. And I guess we'll see you Friday morning for the next episode of The Front Line.
Always a pleasure to be here. And I just want to say, like Phil and Dame Sue Bagshaw, you are the shining lights of medicine in New Zealand and have been for a lifetime. Thank you so much.